How do you plan accessible transportation for travel with disabilities? Imagine stepping into a world where getting around is simple, safe, and respectful of everyone's needs. Planning transportation for travel with disabilities is all about making that vision a reality. It starts with understanding the different types of disabilities, like mobility, sensory, or cognitive challenges, and knowing what transportation options are available. In the United States, the Americans with Disabilities Act requires that public and private transportation services include accessible features. These features include wheelchair ramps, level boarding, accessible restrooms, and clear signage. Making sure these standards are met is essential for fair access. When choosing transportation, look for options that follow universal design principles. This means selecting buses, trains, or paratransit services that have features like secure wheelchair spaces and trained drivers who know how to assist properly. Check that transit stations and stops have accessible paths, curb ramps, elevators, and visual or auditory aids for those with sensory impairments. Connecting with local disability advocacy groups can be very helpful. These organizations understand the specific barriers faced by travelers and can offer advice on the best routes or services. Participatory planning with these groups ensures the transportation options truly meet the needs of the community. Practical planning involves scheduling around medical appointments, allowing extra time for delays. Confirm if personal care attendants or mobility aides can travel with you and if the transportation service can accommodate them. Always verify that vehicles and facilities meet safety standards, including emergency evacuation procedures. Staff training is another key aspect. Drivers and staff should receive sensitivity and accessibility training to help provide respectful, effective assistance. Many regions offer specialized transportation programs funded through federal initiatives like the All Stations Accessibility Program, which improves access at rail stations and transit hubs. The National Aging and Disability Transportation Center offers resources, educational materials, and coordination strategies to improve options for people with disabilities and older adults. It's also wise to have backup plans. Identify alternative transportation like accessible taxis, community shuttles, or volunteer driver programs in case your primary mode isn't available or accessible. In short, planning accessible transportation involves understanding legal requirements, selecting universally designed options, involving the community, addressing practical needs, ensuring staff are trained, and using available resources. This approach helps create travel experiences that are safe, independent, and respectful of everyone's mobility and healthcare needs.